Cerebral Circulation. Chapter 109. Introduction. Brain tissues need adequate blood supply continuously. Stoppage of blood flow to brain for 5 seconds leads to unconsciousness, and for 5 minutes leads to irreparable damage to the brain cells. Cerebral vessels and normal cerebral blood flow. Brain receives blood from the basilar artery and internal carotid artery. Branches of these arteries form circle of Willis. Venous drainage is by sinuses, which open into internal jugular vein. Normally, brain receives 750 to 800 ml of blood per minute. It is about 15% to 16% of total cardiac output and about 50 to 55 ml/100 g of brain tissue per minute. Measurement of cerebral blood flow. 1 KETY and SCHMIDT nitrous oxide method. Nitrous oxide method is an indirect method to measure the blood flow to the brain. It is based on Fick principle, Chapter 98. Nitrous oxide is used as an indicator substance in this method. The subject is asked to inhale nitrous oxide at a low concentration, which is less than the amount required for anesthesia. After inhalation of the gas for about 10 minutes, the amount of nitrous oxide retained in the brain tissues becomes equal to the amount of nitrous oxide present in cerebral venous blood. Now, the concentration of nitrous oxide is determined in the arterial blood and cerebral venous blood, and the cerebral blood flow is calculated by the formula, amount of NO taken by brain. Cerebral blood flow equals arteriovenous difference of N to O. 2 by using radioactive substances. Radioactive substances method is used to determine the amount of blood flow to different regions of the cerebral cortex. Radioactive substance is injected into the carotid artery. By measuring the radioactivity in the brain tissues using radioactive detectors, scintillation counter, the blood flowing through each area of brain is determined. Advantage of this method is that the blood flow to about 250 areas of cerebral cortex can be measured by using many radioactive detectors. Radioactive xenon and 2-deoxyglucose are the commonly used radioactive substances to measure the cerebral blood flow. 3. Bicomputerized axial tomography. Computerized axial tomography, CT or CAT, scanning was introduced in 1970s. Tomography scanning is a process which combines many two-dimensional X-ray images to generate cross-sectional pictures of different organs or regions of the body. Advancement of technology resulted in combination of many three-dimensional X-ray images of body structures and organs including brain. CT scan of brain is useful to determine brain damage and local changes in cerebral blood flow, while the subject performs a task. 4. By positron emission tomography. Positron emission tomography, PET, scanner is a type of computerized tomography machine. A short-lived radioactive substance called radionuclide combined with sugar is injected into the patient. Radionuclide emits positrons, antiparticle or antimatter counterpart of electron. Positron emissions from radionuclide are detected by rotating the PET scanner around patient's head. PET is used to study blood volume, oxygen consumption, pH, glucose utilization, blood flow, and the activity of receptors in brain cells. 5. By magnetic resonance imaging. Magnetic resonance imaging, MRI, is a different type of imaging technique. It involves polarization of hydrogen atoms in the soft tissues by using a large magnet. Measurement of blood flow to a part or area of the organ is called functional magnetic resonance imaging, fMRI. Regulation of cerebral blood flow. Cerebral circulation is regulated by 3 factors: autoregulation, chemical factors, neural factors. Autoregulation. Like any other vital organ, brain also regulates its own blood flow by means of autoregulation, Chapter 102. However, the autoregulation in brain has got its own limitations. It depends upon effective perfusion pressure. Cerebral vascular resistance. Cerebral blood flow is directly proportional to the balance between effective perfusion pressure and the vascular resistance in brain. Effective perfusion pressure. Effective perfusion pressure is the balance between the mean arterial blood pressure and venous pressure across the organ, divided by resistance, Chapter 102. Since venous pressure is zero in brain, mean arterial blood pressure plays an important role in regulating cerebral blood flow. Autoregulation is possible in brain if the mean arterial pressure is within the range of 60 mm Hg and 140 mm Hg. Autoregulation fails beyond this range on either side. Cerebral vascular resistance. When the vascular resistance is more, the blood flow to the brain is less. Resistance to blood flow in brain is offered by intracranial pressure, cerebrospinal fluid pressure and viscosity of blood. Intracranial pressure and cerebrospinal fluid pressure increase in the intracranial pressure or the pressure exerted by the cerebrospinal fluid, CSF, compresses the cerebral blood vessels and decreases blood flow. These pressures are elevated in conditions like head injury. However, severe ischemic effects are avoided by some protective reflexes such as Cushing reflex. Cushing reflex. Cushing reflex is a protective reflex that helps save the brain tissues from ischemic effects during the periods of reduced cerebral blood flow. It is also called Cushing reaction, response, or phenomenon. Increase in intracranial pressure or increase in CSF pressure compresses the cerebral blood vessels and decreases the blood flow. However, blood flow is decreased only for a short period. It is restored immediately by means of Cushing reflex. When cerebral blood flow decreases by the compression of cerebral arteries, the cerebral ischemia develops. Compression of blood vessels decreases the blood flow to vasomotor center also. Local hypoxia and hypercapnia activate vasomotor center, resulting in peripheral vasoconstriction and rise in the arterial pressure. The increased arterial pressure helps to restore the cerebral blood flow. Thus, Cushing reflex plays the most important role in maintaining the cerebral blood flow, Fig 109.1. Cushing reflex operates only when the rise in arterial blood pressure is proportional to increase in intracranial pressure. When the increase in intracranial pressure is very high and if it exceeds the arterial blood pressure, this protective mechanism fails. And the cerebral ischemia becomes severe, leading to irreversible damage of the brain tissues. Monroe-Kelly Doctrine. According to Monroe-Kelly Doctrine or principle, though the cerebral arteries are compressed by increased intracranial pressure or cerebrospinal fluid pressure, the volume of brain tissue is not affected. It is because the brain tissue is not compressible. Viscosity. Increase in the viscosity of blood as in polycythemia, increases the cerebral vascular resistance and blood flow decreases. When viscosity decreases as in the case of anemia, the resistance is decreased and blood flow increases. Thus, the cerebral blood flow is inversely proportional to the viscosity of blood. Chemical factors. Chemical factors which increase the cerebral blood flow: decreased oxygen tension, increased carbon dioxide tension, increased hydrogen ion concentration. Carbon dioxide is the most important factor, as it causes dilatation of cerebral blood vessels, leading to increase in blood flow. A moderate increase in carbon dioxide tension does not alter the blood flow due to autoregulation. When arterial partial pressure of carbon dioxide rises above 45 mm Hg, the cerebral blood flow increases. Carbon dioxide combines with water to form carbonic acid, which dissociates into bicarbonate ions and hydrogen ion. The hydrogen ion causes dilatation of blood vessels in brain. Hypoxia increases cerebral blood flow by vasodilatation. Nervous factors. Cerebral blood vessels are supplied by sympathetic vasoconstrictor fibers. But, these fibers do not play any role in regulating cerebral blood flow under normal conditions. In pathological conditions like hypertension, the sympathetic nerves cause constriction of cerebral blood vessels, leading to reduction in blood flow. It prevents cerebral vascular hemorrhage and cerebral stroke. Applied physiology, stroke. Definition. Stroke is the sudden death of neurons in localized area of brain due to inadequate blood supply. It is characterized by reversible or irreversible paralysis with other symptoms. Stroke is also called cardiovascular accident, CVA, or brain attack. Types. Stroke is classified into two types: ischemic stroke, which occurs due to interruption of blood flow to a part of brain by thrombus or atherosclerotic embolus. Hemorrhagic stroke, which develops by the rupture of a blood vessel in the brain and spilling of blood into the surrounding areas. Causes. Most common factors, risk factors, which causes stroke are: heart disease, hypertension, high cholesterol in blood, high blood sugar, diabetes mellitus, heavy smoking, heavy alcohol consumption. Symptoms. Symptoms of stroke depend upon the area of brain that is damaged. Generally, stroke causes dizziness, loss of consciousness, coma, or death. Other features of stroke: weakness, numbness or paralysis, particularly on one side of the body, impairment of speech, emotional disturbances, loss of coordination, loss of memory.